Hi, I'm Taylor Rizzo, and I'm a registered dietitian at Beltline Bariatric in Atlanta, Georgia. And I'm here to talk to you today about how much protein you should eat in a day. So protein is a really big part of your diet after weight loss surgery, and knowing how much is, of course, a really important factor in making sure you're staying healthy after your procedure. So a couple of things about protein, of course, like we said, it's important to incorporate lots of varieties of proteins in your diet. So protein can come from eggs, cheeses, nuts, yogurts, protein bars, protein shakes, and of course, meats and seafoods and poultry, right? So first of all, knowing what protein is important to making sure you're getting enough in your diet. And then, of course, we want to look at how much. So what we do for calculating protein needs is going to be more of a percentage based on your calories, right? So someone who's eating a lot of calories will need a higher percent or need a higher amount of protein in their diet versus someone who's eating less calories will need less protein, but it's still a percentage of your total intake. So typically a range for protein is somewhere between 10 and 30% of your total calorie intake. Usually after weight loss surgery, I'll recommend being closer to 30% because you do need that higher protein content. This is very individual basis though, so make sure again you do talk to your registered dietitian or healthcare provider to make sure that you're staying within the levels that are safe for you and your past medical history. But let's use 30% as an example because that is a very good recommendation for a good amount of protein post-surgery. So for example, if you're eating 1,200 calories a day, if you want to know how many grams of protein that is, you want to take 30% of 1,200, which is going to give you about 360 calories. And then 360 calories of protein, we want to know how many grams that is. So what you'll do is you'll divide 360 by 4 because there are 4 calories of protein per gram, and that's going to get you 90 grams of protein. So as a quick example, if you're eating 1,200 calories, you want 90 grams of protein a day. But again, that's going to fluctuate based on your calorie intake levels, your activity levels, all that kind of stuff, right? So it is, again, per person basis, but that's just a quick example of how much protein you need. Again, making sure that you're getting protein from all different kinds of sources is super important. And then also making sure you know how to get that protein in, right? So we talked about how much, but how do you actually eat that much after surgery because your stomach size is a lot smaller. And so the way to do that is to make sure you're eating small amounts frequently during the day. Because if you just say 90 grams, that seems like an awful lot. And it is a high amount, but making sure, again, you're having a protein snack maybe every 3 hours. Over the course of the day, you'll get to your 90 grams or whatever 30% of your calories is, and you'll make sure that you stay nice and safe and healthy. So if you are 6 months post-op versus 1 year post-op versus a year and a half post-op, your protein needs can definitely change. So initially, we will definitely want a high protein intake, not only to support your muscles as you're dropping weight quickly after surgery, also for your healing process. And again, as your activity levels change and your health goals change, you may need to increase or decrease protein intake. 6 months post-op, you may be at 20 to 30% protein. At a year and a half post-op, you may be 40 to 50% protein. So again, you may want to make sure you're having lots of follow-up with your healthcare providers, but just know that the percentages can change. On average though, that 30% is what I would look at having. Thanks for watching this video. Make sure to subscribe, comment, and like the video. Come back to our channel for more. And if you'd like to make an appointment with our office, you click the link below.